Good evening. My name is Kelly Graves. I'm a student at Aspen University. The date of this fourth week assignment is June 4th, 2019. I will be discussing the development of a new informatics system in the workplace on this PowerPoint assignment. The objectives that will be focused on during this PowerPoint assignment are as follows. I will explain the importance of usability, configurability, and interoperability of an EHR, electronic healthcare record. The importance of desirable characteristics when selecting the team members for the development of new informatics system in the workplace. I will explain the term lead with culture, determining where the resistance is. Also explained will be the methods of getting a new user buy-in. I will help recognize the possibility of pitfalls when building a new system into a new healthcare facility. And also I will share some personal use systems and opinions of each of the EHRs that I have utilized during my career. First thing I do is explain the understanding of usability, configurability, and interoperability. Usability. That promotes the user's ability to effectively and easily document patient care events and treatment in a healthcare facility. Configurability is a system that is easy to configure, allowing the owner to easily personalize certain aspects of the system. And then third, interoperability. Interoperability refers to a system's ability to create the possibility of different EHR systems exchanging information amongst each other, amongst the different providers. Usability. Many systems purchased without adequate attention to usability in healthcare facilities. By purchasing the inadequate usability systems, you have decreased user buy-in and productivity, you have increased documentation errors, delayed patient treatment, user frustration, and increased user support costs. Configurability. This is software's ability to adapt to meet the user's needs. The ability of a system to be upgraded is needed as the user's needs change. Reducing the total cost of ownership over the lifetime of the software, it's built to accommodate healthcare practice patterns and workflows, and it's also systems vary depending on healthcare facility, size, specialty, and the setting itself. Configurability allows providers to configure an IT environment. It best suits the specific workflows and patient populations. It allows vendors to focus on specialized applications, and it's tailored technology providers require. Interoperability. This is the software's ability to exchange healthcare information across other healthcare information systems. The need exists for software to connect with both the new and the pre-existing systems. Providers cannot operate effectively without exchanging patient data. Providers must be able to share information. By sharing information, it reduces hospital admissions and readmissions. It improves patient care, and it certainly reduces the costs of health care. Now I'll discuss the priority of characteristics. The priority of usability, configurability, and interoperability versus cost containment. Decreased time spent pulling charts, decreased billing associated costs, reduced transcription associated costs, increasing your pharmaceutical formulary compliancy, and improved patient visit coding are all parts of a usability, configurability, interoperability system that actually will help with cost containment. Additional benefits of the usability, configurability, and interoperability of an electronic healthcare record is the simplification of transitioning patient care among providers. The ease of tracking the referrals, the consultations, the orders, labs. It also supports maintaining up-to-date, accurate, complete information on patients' health. It also improves the patient and provider communications and promotes legible, complete documentation. Another priority by a facility employing a computer system that has high usability, high configurability, and high interoperability, that facility is going to have higher staff retainment because they're going to have improved job satisfaction. As opposed to battling a system, they can embrace a system. It decreases the repetitive tasks that a health employer does during the day. It improves the communication amongst healthcare members. It's easier to be compliant with regulatory rules of with licensing, and it also demonstrates, when completed with the documentation, a high quality of care. As a nurse of many years, I've used multiple different electronic healthcare records, and I have to say that the most user-friendly was a system called the T system. The T system was designed specifically for emergency department documentation. Um, it was intuitive. It had a very intuitive workflow and supported all levels of patient acuity from the stub toe all the way up to the respiratory arrest. It promotes ease of documentation. It was a simple learning process and high configurable to the specific ED EHR needs. As a team leader in establishing a new electronic healthcare record system for a facility, it's crucial to choose your team members carefully. There's specific characteristics that are appealing in a situation of a team working together. Number one is you want to look for team members that are excellent communicators. You want these people to be organized. You want them to be easy to work with. They all need to be confident to be able to make suggestions, maybe be rejected with their ideas, but then again continuing to build on ideas despite maybe their first idea not being accepted by the entire team. Therefore, which leads to one of the most important things is to be a team player. On that team, it's crucial that certain jobs titles be included on the team. Physicians, who will be an end user of the product, nurse practitioners, physician assistants, nurses, they all need to be included on the process of choosing and implementing a new electronic healthcare record for a facility. Pharmacists should be included, lab personnel, and of course IT personnel or consultant to help to bring on the specialty of the EHR system. Setting the culture. Lead with culture, determining where the resistance is. This is a SIPES quote, meaning that the use of the resistance to be effectively lead a group is essential. There will always be some resistance. You need to determine the underlying cause of this resistance. Sometimes it's fear or anxiety regarding learning a new system. Sometimes suggestions are interpreted as criticism. And sometimes it's just people are just struggling with change. These are all reasons that you might end up with a little resistance from the end users of this new system that's going to be implemented. Transforming resistance, dealing with the end user resistance. Don't deceive the user. Deceiving the user will just add mistrust to the circumstances. Allow for the leader's concessions when users recognize issues, and therefore then you want to collaborate with those users for updated plans and actions. You want to engage the resistant party. Do not attempt to persuade. Clarify the user objections and ask for options. The lack of amount of time that is assigned to a project can be an absolute pitfall to a project. It's essential to provide adequate amount of time that we can capture fully committed team members and eliminate the feeling of being rushed. Scope creep, another possible pitfall when creating a new system in a healthcare facility. Numerous revisions during that building process. These numerous revisions can frequently are frequent changes of plans, and they cause missed deadlines. Increased costs related to installation and maintenance contracts are other possible pitfalls. Inadequate testing, which are complications and delays with the official rollout, is what will happen without adequate amount of testing. Inadequate training. Not training your users creates stress, and it creates negative attitudes towards the entire project. Personal experiences with health informatics systems for myself. I've used Meditech. It was the most difficult EHR for me to learn. It was very none of it connected. It was not a very user friendly program. Once I mastered it, it was an effective system. However, it never was a friendly system. It was never easy, but I did manage to master it. The T system, as I mentioned earlier, is the most user friendly EHR that this user has ever experienced. It flowed. It made us look very. This nurse's personal experiences with health informatics systems are as follows. Meditech, which I learned early on in my exposure to EHRs, was the most difficult to learn. Whether it was because it was the first EHR or was it rather because it was just not a very user friendly, I struggled with the Meditech. Once I mastered it, I found that the system was effective. I just really needed to be careful. It didn't do a whole lot for me to help me see my errors. The T system. The T system, as I spoke of earlier in this PowerPoint, has been the most user-friendly EHR that I have ever used. It was designed for the ER. It led documentation exactly down the right path, depending upon what that patient complaint was. Cerner I've used many times as well. It's a middle-of-the-road system. I managed to use it. However, it was definitely not the most friendly and did not communicate so well with other systems around it. Epic is what I've used in the last 5 years at every facility that I've been to in Arizona and Washington State. It's the most recently that I've had the most exposure to. I've used it in the ED, I've used it in multiple different settings, and they manage to direct each department with what's appropriate for their documentation. I've been using it for approximately, again, 4 or 5 years now. In the last 6 to 8 months, I've been in the emergency department, and I'm finding that it is somewhat of a user-friendly computer system once you actually get comfortable using it. Thank you very much. I appreciate your audience. My references are included.